Hello, everyone. Welcome. I'm seeing folks joining in. Welcome. We're going to get started because we do only have 30 minutes and this is being recorded. Just thank you for joining the Chicago Asthma Consortium today. We're really thrilled that you're here and ready to learn. We're going to go to our program now. So, oh, we can mute. If you could all go on mute when you're joining. Thank you. So today's topic is asthma care in schools, policy, practice, and the role of the school nurse. Today's discussion really does reflect the CAC's mission to improve the quality of life for those living with asthma through advocacy, education, and collaboration. We know that schools play a vital role in that mission, and today's session is going to highlight how policy, healthcare systems, and school-based leadership intersect to improve outcomes for children. So we're really excited to have you here with us. And here's just our agenda for today for everybody to stay on track. We're going to be having a brief overview of the CAC and then our speakers for today. And then from 12:05 to about 12:20, myself and Rachel will guide us through the asthma care in schools, exploring policy frameworks, practical implementation strategies, and the essential role of school nurses. Following the presentation, we'll open the floor for questions and discussion. So our goal really is for you to leave with practical insights, policy awareness, and then very actionable strategies that you can bring right back to your health office. For those newer to the CAC, the Chicago Asthma Consortium, here's our mission and our purpose. Please stay connected with us. Our mission centers on advocacy, education, and collaboration. Through partnerships and shared expertise, we really do work on strengthening systems of care and improving that quality of life for children and families impacted by asthma. So here are ways that you can help. If you're interested in becoming more involved, we will definitely put you to work. So the CAC offers numerous opportunities through committees, volunteer work, policy and advocacy initiatives, professional development, of course, and that community engagement. We encourage all of you to stay connected and to please continue strengthening this work beyond today's session. So now it's really my pleasure to introduce our speakers, and I am joined by Rachel Morkunas, Assistant Director of Program and Policy at the Respiratory Health Association, whose work really does focus on systems level asthma policy, school partnerships, and public health advocacy. My
Hi,
name is
everyone.
Hi, Rachel. My name is Gloria E. Barrera. I'm a nationally recognized school nurse leader, director of the UIC RN to BSN program, and a certified school nurse expert with extensive experience in school nurse leadership, school health leadership, asthma advocacy, and public health systems. So together we bring many years of experience in both policy and frontline expertise in this really important conversation. So now let's just dive into asthma care in school. So asthma, we know, is one of the most common chronic diseases affecting children, and schools are one of the most critical environments where asthma management either succeeds or it fails. So today we'll discuss how that policy framework, practical systems, and school nurse leadership really do work together to improve student health outcomes. And we really hope that this session strengthens your understanding and builds practical confidence and reinforces the essential role that school health professionals play in asthma care. These are our session goals. First, aligning policy with practice by examining how asthma standards translate into school communities and that school implementation. And then second is highlighting that leadership role of school nurses in creating and sustaining really safe systems. And then third is sharing actionable strategies that you can use immediately to improve asthma care consistency, safety, and equity right where you're at. So this is about moving from awareness to now systems change. So why does asthma matter in school? Well, asthma affects more than 6 million children, school-age children in the US, and it remains one of the leading causes of school absenteeism and significantly impacts academic performance. We know that, social participation and physical activity. So schools often represent the most consistent point of healthcare access for many students. So this means that schools are not simply educational institutions. They really are essential healthcare environments, particularly for chronic disease management. The school reality. So despite our best intentions, many gaps remain visible, and it's less than ideal between asthma care and daily practice. So ideally, every student would have a current asthma action plan, medication access, trained staff, and proactive interventions. In reality, though, many schools face outdated plans, inconsistent medication availability, variable staff readiness, and also communication breakdowns. So these gaps can really directly contribute to preventable emergencies. The policy landscape. So asthma care is shaped by multiple policy layers. Its state laws establish the legal protections. District policies then create those procedural frameworks. And then school implementation determines whether those protections function effectively or not. And then understanding these layers, it's really essential because school nurses often serve as that bridge translating policy into operational safety. From policy to practice, policy alone does not save lives. Implementation requires workflows, accountability, education, and leadership. So the school nurse plays the critical role of translating those legal requirements into day-to-day practice, day-to-day systems that really do protect our students. When done effectively, this directly improves health outcomes. In Illinois, school nurses must navigate several key areas, and that's asthma action plans. We know that we have to request them every year, and that's mandated by the state. Medication administration laws, yes, we have those. Stock albuterol legislation, documentation requirements, and then really understanding these legal explanations is essential, not only for compliance, but also for student safety and professional protection. The role of the school nurse, and this is not all encompassing, but the school nurse functions as a clinical expert, care coordinator, policy implementer, educator, advocate, and this multifaceted role has the nurse central to asthma system for it to be a success. School nurses are not simply responding to emergencies. They really are leaders in asthma care. So the system approach to asthma care, effective asthma management requires clinical systems, identifying students early, maintaining records, monitoring symptoms consistently, and then ensuring that the continuity across transitions really does stay intact. So without those strong systems, students are more likely to fall through critical safety gaps. Here, the asthma action plan, I know that many of you have already seen this, you already know this, so this is just an overview. The asthma action plan really is foundational. The green zone supports prevention, the yellow zone guides cautionary intervention, and then the red zone directly is that emergency response. So these plans, should be current, individualized, provider signed, and accessible. Common gaps in school asthma care. So these are common vulnerabilities, and that includes missing or outdated plans, limited staff awareness, inconsistent implementation, and then the communication failures that exist. So these are system issues, not individual failures, and they do require system solutions. And so the strategy really is that standardization, and that creates reliability. So having the annual asthma action plan collection, centralized tracking, clear documentation, and this really does ensure safe care of staffing variability that may exist within schools. I'm going to hand it off to Rachel for the staff training.
Great, thanks, Gloria. This is a really important part about how these kind of policies are translated into practice. And like Gloria mentioned, you guys as school nurses are often the ones bringing these policies to life in the day to day. So, even when strong policies are in place, if staff at the school level doesn't feel prepared to respond, we'll still see those delays in care for students with asthma. And so that's why staff training is so important, not just for school nurses, but for everyone in the school building, because everyone has potential to kind of be that first responder in an asthma situation for students. So there are a few key things that staff need to feel confident in addressing an asthma situation. The first is being able to recognize symptoms. So things like coughing and wheezing and shortness of breath. Being able to recognize that these are often the early warning signs. That a student might be entering an asthma episode. The second is understanding the different zones of the asthma action plan. As Gloria mentioned, most action plans use that green, yellow, red zone framework. And so, staff don't need to know every detail, but they should understand what each zone means and how to help. It helps them guide, on what to do next. And the third is knowing when to act. So this is where that confidence really matters. And staff should feel comfortable responding right away, whether that's, sending to the school nurse if it's not the nurse who is addressing the immediate asthma episode, helping them access their medication, or escalating the situation based on the school's emergency response protocol. And at the end of the day, staff training helps make sure that staff aren't hesitating in those moments where action is needed, and they feel really prepared and ready to act. And so I'll talk a little bit later, but one of the things we offer at Respiratory Health Association is training for staff in asthma management.
Thank you, Rachel. So the medication access, that really is critical, and students should self-carry when appropriate. And schools really do need those stock medication systems. And of course, we know that in Illinois, it's Rescue Illinois. We we're providing the stock albuterol free to all Illinois public schools. So medication must remain accessible throughout all school activities, and that even includes after school activities. We know that for middle school, high school, there might be events happening, clubs, sports after school. So we want to make sure that that stock albuterol is accessible to all for example, coaches or club sponsors. So timely access really does directly save lives. Advocacy and action. So, school nurses are powerful advocates. If you're part of the Illinois Association of School Nurses, you've already seen that we were at School Nurse Lobby Day in Springfield. That happens annually. Please make sure that you're taking advantage of that and using your voice. So, through that legislative engagement, through those policy conversations, and that professional leadership, nurses really are helping shape safer systems. So advocacy transforms frontline experiences into that systemic change that we're all needing to see. And it was school nurses that were partners in passing the Rescue Illinois funding for, and that was because we were advocating for it with our legislators, letting them know that this is a need and we do need this in our school health offices. And that's why it's been a success. And so the rescue program, so one of the most impactful examples of policy meeting practice in Illinois is the rescue program. So the rescue represents a proactive, that statewide initiative designed to ensure that no student experiences an asthma emergency at school without immediate access to potentially life-saving medication. So throughout the program, participating schools maintain that stock albuterol inhaler on site for emergency use. So this is especially critical because many students either forget their inhaler, do not have one readily available, or may not have yet that formal diagnosis despite experiencing symptoms. So the power of that stock medication cannot be overstated during an asthma episode. Every minute matters. Immediate access to albuterol allows school personnel, not just school nurses, to intervene quickly, reduce that respiratory distress, and then prevent escalation to more severe medical emergencies requiring EMS hospitalization or, activation. So the rescue program is also an important health equity intervention. Students from underserved communities often face great barriers to consistent medication access due to cost, due to transportation challenges, and due to insurance issues or fragmented healthcare access. So that stock albuterol it really does help bridge the gap and ensures that a student's safety is not just determined by their family's financial or logistical circumstances or their zip code, to be quite frank. So those outcomes really are significant, and schools utilizing the rescue program report reduced emergency transports, fewer missed instructional hours, which we know that that's big, and increased confidence among school personnel outside of school nurses responding to that respiratory distress. So beyond that individual student, outcome, rescue also demonstrates how thoughtful legislation, public health partnerships, and that school nurse leadership, we really can create scalable systems that improve health outcomes statewide. So this program is not just about emergency medication access. It's really about building safer schools, reducing disparities, and strengthening the roles of schools as critical public health access points. So as school nurses and advocates, programs like Rescue Illinois remind us that when we combine policies, systems, and frontline expertise that we have, we can really create measurable life-saving change for children. Rachel?
Yeah, thanks, Gloria. So just to kind of talk a little bit more about RHA, at RHA, a big part of what we focus on as an organization is trying to bridge that gap between what happens in the clinical setting, and then what happens in schools or, at home with families, just so make sure that students with asthma are supported consistently. And we do this in a couple different ways. So the first is our focus on education and training. And so we provide evidence-based asthma education for school staff, for students, and then for families. So really caregivers of students with asthma. And, these trainings help schools meet state requirements. And also, like I talked about, feeling more confident in responding to asthma symptoms and asthma emergency situations. If you're interested,
So we tried.
sorry about that. So the second is, we do a lot of work with direct partnership with schools. So we work closely with schools and school districts to implement programs, along with AIR, like the stock asthma rescue medication program, our asthma management education, again, to help support, in the alignment with state policies, with the goal to really make sure that schools have systems in place so students can access the care when they need it. Another way we do this is by helping link school staff, school nurses, with outside organizations, advocacy networks. Like Gloria talked about, your voices really matter and are really impactful. And this can also just, again, help strengthen that care coordination and ensure students are supported appropriately and just not just, in the school setting, but beyond. And lastly, we do a lot of work at the policy and systems level. So, we're actively involved in advancing policies and programs that improve asthma care across Illinois, like the rescue program. We work in the environmental space to try and push, legislation and policy around electric buses to make sure that the airs that we breathe is cleaner. And so, we don't just work with one school or one district, but we try and, approach it more broadly. And really, I think at the end of the day, when schools are able to connect to a broader public health system, like Gloria mentioned, and are supported through those strong partnerships, it can create a more consistent and equitable approach to asthma care. And that's really what helps drive those better outcomes for students living with asthma.
Thank you, Rachel. So moving forward, I think this was still your slide if you want to just
Yeah.
focus on this. Yes.
Yeah, so I think, just kind of looking at this, what we've talked about, and actually putting it into practice. I think asthma outcomes in schools doesn't just come down to one thing. It takes action across a few key areas where we all work together. And one of the main themes we've talked about today is aligning that practice with policy. And this is where you, as the school nurses, come in. You make sure what's happening at the day to day, especially when it comes to medication access and emergency response, really kind of reflect what the current policies are designed to support at the school level. And looking at strengthening school systems, so trying to build consistency in how asthma care is managed at the school level. For example, how asthma action plans are collected, how staff is trained, how medications are stored and accessed, and kind of identifying and recognizing where gaps in that may exist and kind of working to address those through ongoing training. Um, and then, leading through advocacy, like I said, and Gloria said, school nurses and school staff, you're often the first to see where a lot of these challenges come up, whether that's barriers to medication access or issues to implementation. And your perspective is really important. And using your voice to help us elevate those challenges can help drive those broader improvements in the asthma space statewide. And then just kind of reiterating that building of partnerships. Asthma care doesn't just stop at the school, right? It involves family and healthcare providers and community partners. And the stronger we make all of those connections, the more consistently we can help support those students. So, when we're working together and you know kind of are all connected, that's kind of, I feel like, when we start really seeing those meaningful improvements and outcomes for students with asthma.
Thank you. And it is 1:22, so we are right on time. Here are our references, and I just wanted to thank you all, and we will open it up now for a dialogue, for discussion, just questions that you might have. So I'm going to stop sharing so I could see everybody's faces if you want to come on camera.
Alexa, turn on the living room lights.
Okay. Hi, Pam. Hi, Mark.
Hello there, Gloria. I've
Hi.
got a question for you.
Yes, sir.
It has to do with the fact that most schools do not have a school nurse there every day. And you've got after school sports activities. Do these coaches have an albuterol rescue with them? Because you've got multiple activities, be football and soccer outside. And yet, if you don't have a nurse there, do they have adequate distribution of these devices with a full understanding of the proper administration of them?
Yeah, I'll take this one. So I think that that is the ideal goal, right? For all school personnel to be fully trained. So, for example, in a high school, it would be the coaches, the PE teachers, it would be all the club sponsors, really all administration. But the reality is that doesn't happen. Is that a goal that we're working towards? Yes. And those we have boxes where you can put, the rescue inhalers, but also other stock medication and stop the bleed, for example. All of those boxes should be right next to the AEDs. So in Illinois, it's the cardiac emergency response plan that requires that, everybody is trained in emergency response for cardiac emergencies. But the same can be that all of those individuals should also be trained in asthma emergencies. And so that really is the goal, and that's what we're working towards. But you're right, that is a gap. And especially when there's not a school nurse in the building, I think that really is the crux of it. And that should be the question that we're all asking as the public, right? Who is our school nurse? And making sure that if somebody can't name that person, then we ask why and we advocate for a school nurse to be in every building every day instead of, managing 4 to 5 buildings in some areas. Thank you for the question. Any others or any other discussion follow-up on that? Thank you, Mark.
You're welcome.
Oh, I'm not seeing the chat. One second. Oh, Rochelle, thank you. So for everybody that joined, if you could please share your feedback using that link in the chat. Um, Gabriela, thank you for joining. Um, I don't think I've seen any questions in the chat. You can also include that in the chat if you're unable to come off mute.
There is a question from Bridget who just came in the chat.
Oh, Bridget. Bridget Joyce, how do you suggest getting involved at the policy level? Is that referring to just in nursing in general? I would say joining a professional organization is the easiest way. You can do it alone, sure, but with a professional organization, it'll be much faster, much more efficient. Power in numbers, right? So joining a professional organization. Bridget, I'm not sure if you're a nurse or not, but you would asthma specifically. Okay, so I'll hand that over to Rachel, but definitely joining an organization, Rachel, and the CAC. Yes.
Yeah, yeah, definitely. Everything Gloria said, and also,
Hi,
you know,
respiratory. Hey.
hi, yeah, and just you know, we also are always looking
Mm-hmm.
for advocates and champions.
DCM.
Oh, okay, I think she's muted now. But yeah, we're always looking for asthma, and so we do a lot of work in the advocacy space. And so, if you're interested in being an advocate with Respiratory Health Association, we have a sign-on form, and we have lots of. We just did, for example, at the end of March, we did an advocacy day down in Springfield, and one of the things we advocated for was funding for the Rescue Illinois stock program. So, if you'd like to learn more about that, I'll put the link in the chat to our advocacy site, and you can read more about it and kind of how to sign up. But yeah, we're always looking for lung health champions to help amplify our voice.
Wonderful. Well, thank you everyone for joining, and we hope to see you at many more lunch and learns. And these are quick, snippets, 30 minutes, so that you can continue coming back. And we really appreciate you being here. Rachel, thank you for including that, the advocacy for the Respiratory Health Association. Appreciate it. And we'll see you at the next one. Thank you, everyone. Bye-bye.
Bye.